Hello everyone and welcome back to Speak Healthy. Today, we're going to talk about some of the most common and sometimes unexpected causes of leg pain that can be adversely affecting your day-to-day activities. Are you trapped in a cycle of relentless leg pain that just won't quit? Whether it's a constant ache, a burning sensation, or intermittent sharp pangs that travel from your hips to your toes, chronic leg pain isn't just an inconvenience. It's a life-altering ordeal that can hinder your mobility, disrupt your sleep, and hijack your peace of mind. If you're tired of limping through life and are desperate to know what's triggering your agony, you're not alone. From hidden nerve issues to lurking diseases, we're diving deep into the labyrinth of causes behind chronic leg pain. Buckle up because understanding is the first step toward relief. If it's your first time here at Speak Healthy, please be sure to like this video and subscribe to our channel for more content to better your health. Let's start with our first cause of leg pain: muscle strain or sprain. At first glance, the terms strain and sprain might sound interchangeable, but they refer to different types of injuries, both of which can cause considerable discomfort and restrict movement. A muscle strain, also known as a pulled muscle, occurs when muscle fibers are overstretched or torn. This can result from forceful or sudden movements, lifting something too heavy, or overworking a muscle group without adequate rest. Symptoms of a muscle strain in the leg can include pain, muscle spasms, swelling, and limited flexibility. The severity can range from a mild stretch to a complete tear. In contrast, a sprain involves the ligaments, which are the tough bands of tissue connecting bones to each other. Sprains in the leg often occur in the ankle or knee regions. They happen when a ligament is stretched beyond its limits or torn. Common causes include twisting the leg, falling, or receiving a direct blow. Symptoms of a sprain might encompass pain, bruising, swelling, and instability of the affected joint. Sciatica, an agonizing pain that can shoot down the back of the leg. Sciatica is not a medical condition in itself, but rather a symptom of an underlying issue affecting the longest and widest nerve in the human body, the sciatic nerve. The sciatic nerve originates from the lower lumbar region of the spine and travels down through the buttock and leg, branching out to supply sensation and muscle function in the thigh, calf, ankle, foot, and toes. When this nerve gets irritated or compressed, the resulting pain, numbness, or tingling is termed as sciatica. The hallmark of sciatica is pain that typically starts in the lower back or buttock and radiates down one leg. It can vary from a mild ache to a sharp burning sensation or excruciating discomfort. Sometimes it might feel like an electric shock. Besides pain, sciatica can also cause numbness, tingling, or muscle weakness in the affected leg or foot. Peripheral artery disease. Peripheral artery disease, commonly abbreviated as PAD, is a circulatory problem in which narrowed arteries reduce blood flow to the limbs. This condition frequently affects the legs, although it can also impact other arteries in the body. The primary cause of PAD is atherosclerosis, a condition in which fatty deposits or plaques build up on the arterial walls. Over time, this buildup can restrict blood flow. However, atherosclerosis isn't the only cause. Inflammation of the blood vessels, limb injury, radiation exposure, and unusual anatomy of the ligaments or muscles can all cause PAD. Risk factors for PAD include age, smoking, diabetes, obesity, high blood pressure, high cholesterol, a history of vascular disease, stroke, or heart disease, and a family history of PAD or related conditions. Deep vein thrombosis. Deep vein thrombosis, DVT, is a potentially serious condition characterized by the formation of a blood clot, thrombus, in one of the deep veins, most commonly in the legs. While DVT can sometimes be asymptomatic, the consequences of an untreated clot can be severe, making awareness and early intervention crucial. Symptoms of a DVT include 1. Swelling in the affected leg, occasionally extending to the foot and ankle. 2. Pain or tenderness in the leg, which might only be felt while standing or walking. 3. A feeling of warmth in the affected area. 4. reddish or bluish skin discoloration. 5. The sensation of heaviness or cramping in the leg. Chronic venous insufficiency. Chronic venous insufficiency, often referred to as CVI, is a condition wherein the leg veins do not allow blood to flow back to the heart effectively. Typically, our veins have one-way valves that ensure the upward flow of blood against gravity. When these valves become damaged or weakened, they fail to function correctly, causing blood to accumulate in the leg veins, leading to CVI. Symptoms of CVI. 1. Swelling. This is often observed in the ankles and calves. 2. Pain. Individuals might feel an aching or cramping sensation in the legs. 3. Skin changes. Over time, the skin on the affected legs may become thick, change color, or become leathery in texture. 4. Varicose. Veins. These enlarged, twisted veins can become more prominent. 5. Itching or tingling in the affected area. 6. Ulcers. In advanced cases, painful ulcers can form on the skin near the affected veins, especially near the ankles. 7. A feeling of heaviness in the legs. Arthritis. Arthritis is an umbrella term used to describe inflammation of the joints. While it can affect any joint in the body, when it targets the legs, the impact can be particularly debilitating due to the leg's role in mobility and weight-bearing. Let's delve into some of the primary forms of arthritis that afflict the leg joints and their implications. 1. Osteoarthritis, OA. OA is a degenerative joint disease wherein the cartilage that covers the ends of bones in the joint deteriorates over time. Symptoms include pain, stiffness, loss of flexibility, grating sensation, bone spurs. Leg joints affected. Knees are the most commonly affected, but hips and ankles can also suffer from OA. Causes: wear and tear over time, genetics, joint injuries, and obesity. Treatment: pain relievers, anti-inflammatory drugs, physical therapy, weight management, and in severe cases, joint replacement surgery. 2. Rheumatoid arthritis, RA. Rheumatoid arthritis is an autoimmune disorder where the body's immune system attacks its own joint tissues. Symptoms: tender, warm, swollen joints, morning stiffness, joint deformity. Leg joints affected. While RA can affect any joint, knees and ankles are commonly involved in the legs. Causes: exact cause is unknown but is believed to involve a combination of genetics, environmental factors, and hormonal imbalances. Treatment: disease-modifying anti-rheumatic drugs, DMARDs, biologics, pain relievers, and physical therapy. 3. Gout. Gout is a form of inflammatory arthritis caused by the crystallization of uric acid in the joints. Symptoms: severe pain, redness, swelling, and warmth in the affected joint. Leg joints affected. Big toe is the most common, but other foot joints, ankles, and knees can be affected. Causes: high levels of uric acid in the blood, which can be due to diet, genetics, or under-excretion of uric acid by the kidneys. Treatment: non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, medication to lower uric acid levels. 4. Ankylosing spondylitis. Ankylosing spondylitis is a type of inflammatory arthritis affecting the spine but can also affect other joints. Symptoms: chronic pain and stiffness in the lower back, buttocks, and hips. Leg joints affected, hips and sometimes knees. Causes: genetics play a role, but the exact cause is unknown. Treatment: physical therapy, exercise, NSAIDs, and biologic medications. 5. Psoriatic arthritis. Psoriatic arthritis is a form of arthritis affecting some people with psoriasis. Symptoms: joint pain, stiffness, and swelling. Reduced range of motion. Leg joints affected, knees, ankles, and toes. Causes: combination of genetic, environmental, and immune factors. Treatment: NSAIDs, DMARDs, immunosuppressants, biologics, and physical therapy. Shin splints. Shin splints, medically termed medial tibial stress syndrome, is a condition characterized by pain along the inner edge of the shin bone. tibia. Often the bane of runners, military recruits, and athletes, shin splints are typically a result of sudden changes in physical activity. This can mean an increase in frequency, duration, or intensity, or even a switch in training terrain or footwear. Peripheral neuropathy. Peripheral neuropathy refers to the disorders that arise when the peripheral nerves, the complex network of nerves that connect the central nervous system, brain and spinal cord, to the rest of the body, get damaged or disrupted. These nerves are responsible for sending information to and from the brain, including sensory feedback and muscle control commands. Damage to these nerves can manifest in various ways, with the legs and feet often being the most affected areas. Restless leg syndrome. Restless leg syndrome, also known as Willis-Ekbom disease, is a neurological condition that creates an irresistible urge to move the legs. This urge usually comes with, or is caused by, uncomfortable and unpleasant sensations in the legs. These feelings typically occur when the individual is resting or inactive, and they can make it difficult to fall asleep or remain asleep, leading to daytime fatigue or sleepiness. Muscle cramps. Muscle cramps are spontaneous, often painful contractions of one or more muscles. They are colloquially referred to as Charlie horses and can affect any muscle group. Most commonly, they occur in the leg muscles and can be intensely painful, albeit usually short-lived. While the exact cause of muscle cramps is sometimes unknown, they can be associated with a variety of conditions and factors. Baker's cyst. A Baker's cyst, also known as a popliteal cyst, is a fluid-filled sac that forms behind the knee. It arises when excess synovial fluid, the lubricating fluid in the knee joint, accumulates and forms a bulge in the back of the knee. While many Baker's cysts are symptom-free and only discovered during a physical examination or imaging test for another condition, some can cause discomfort and restricted knee movement. Medication-induced leg pain. A closer look at statins. Medications, while primarily intended to treat or manage specific conditions, can sometimes lead to unintended side effects. One well-documented instance is the muscle-related effects caused by statins, a class of drugs predominantly used to lower cholesterol levels in the bloodstream. The potential for muscle pain or discomfort, often referred to as myalgia, is a concern for some taking these drugs. And that's our fairly comprehensive list of common causes for leg pain. If you found our content to be informative, please don't forget to subscribe to Speak Healthy. We hope you drop by again soon.